It's widely understood that there's significant drinking among adolescents or underage drinkers in the United States, but something that is not as well known is what are the consequences of this drinking, how widespread is it? We know that drinking in teenagers or young adults is associated with motor vehicle accidents, with many injuries, as well as suicides and homicides. But what wasn't known is how frequently they're hospitalized, a significant consequence of underage drinking, particularly binge drinking. So this study was really an attempt to look at how widespread is hospitalization, how costly is that, and are there any specific identifiers of youths that drink and end up hospitalized so that there could be prevention done to diminish the amount of hospitalizations. What was striking about this study is that there is widely prevalent hospitalization for underage drinking. What we were able to do is look at a national data set from multiple healthcare providers and look at discharge diagnoses of youth between ages 15 and 20 who are hospitalized to determine what percent of those patients have hospitalizations from alcohol intoxication, alcohol abuse, alcohol addiction, or emotional problems related to their drinking. What was found that in a sample there were approximately 700,000 hospital discharges among American youth. 40,000 of those were related to alcohol. The cost of those hospitalizations is estimated to be approximately $755 million annually. A substantial amount of that money are for hospitalizations that were related to injuries. That of the $755 million of the annual expense, over $500 million is related to those hospitalized that had injuries associated with their drinking. In looking for, among these adolescents, was there anything defining of those who were hospitalized for their drinking? And as you mentioned, it was related, it was much more likely to be males, about 61% males over females, that the older among that group, the more likely that they were going to be hospitalized for their drinking problems. And then also we looked whether there was a region of the country where youths were more likely to have alcohol-related hospitalizations. In the Midwest and the Northeast regions of the country were much more likely than the South or the Western regions. Finally, we looked at, are there ethnic groups where there is greater risk for the youth who are drinking? And another striking finding of the study is that white youth were more likely to have hospitalizations for drinking-related problems than any other ethnic group other than Native Americans. And the Native American group, particularly in the Midwest, were at particularly high risk for hospitalization related to alcohol use. We know that underage drinking is widespread. This lets us know that the consequences of this underage drinking was widespread, that it's a significant expense for the healthcare system, $755 million a year. So it's very costly for the system, it's costly for these youth. Many of them are being admitted intoxicated and they have injuries. The data also helps us to look forward at how we might prevent underage drinking or negative consequences of underage drinking. Are there groups that we need to target? And which regions of the country may we want to put more national resources for targeting youth? And we're looking at the Midwest and Northeast. We're looking at particularly at white males and females between ages 15 and 20, and we're also looking at the Native American youth group as another very high-risk group to target efforts of prevention. It is a call for action, and this is more information for us to understand the problem better.